Well, last month, Governor Evers issued the official proclamation declaring the entire year of 2020 the 100th anniversary of pediatric care at the University of Wisconsin.
A hospital, of course, is never a place that you want to visit, but from the moment you walk into the lobby of the American Family Children's Hospital, you realize it is a special place. Dr. Ellen Wald, the chair of the Department of Pediatrics, and Barbara Byrne, vice president at American Family Children's Hospital, took us on a tour. The 8-story, 111-bed American Family Children's Hospital opened next to UW Hospital in 2007.
The Children's Hospital is themed after all things Wisconsin.
Oh, I love that.
So each floor has its Wisconsin themes, and that actually came from our parent advisory group suggestion. This is the Door County Lighthouse over here.
Very nice.
And then as we go around that side, it's the old streets of Wisconsin. We were really trying to make it a magical place for children so that when they walked in the building, it wasn't this frightening, sterile environment. So I think they did a really good job.
The hospital is in a different league from children's hospitals of the past, and the way in which care is provided has evolved too.
As much as possible, we've tried to put elements in that help a child feel comfortable in the environment so it's not so frightening. Because you can imagine, right, walking in here and seeing the equipment on the, on the walls, etc. That would be frightening, and it still is to a certain degree, but we definitely try to take the edge off.
The campground.
Yep, the campground. And so everything in here is designed like you're going camping. So walk on into the campground
Let's go for a hike.
Yeah. This is a parent waiting area, and we get a little stoop for the children, tree trunk.
All you need are some s'mores.
And she helps them prepare for surgery, and she helps them pick out what smell of gas they might want today.
So I have a little menu.
What are their choices? Like
Grape, strawberry, watermelon.
Oh my goodness.
Bubble gum. You used
Bubble gum, root beer.
Oh, you're kidding me.
Yeah. Parents have already visited the playroom, and then they're like, oh my gosh, we talked about this at home, look at, and they can play. So so sometimes my job is partly done, but it's nice because I can reinforce it, or we can come here and play. And I don't have my backpack with me, but I have like the stickers they'll use and the leads and all that stuff. So yeah, so sometimes we're helping the baby go to sleep, and then I bring out a mask their size and say, hey, look, can you try like the baby?
Tyler's Place is a place that siblings are able to be cared for in this environment. So if siblings are coming with a family to a clinic appointment, they're able to drop their children off here. This is a hybrid OR. And in this room, this is only one of a couple ORs in the nation.
United States.
What is a hybrid OR?
It has the most precise equipment to visualize and to target whatever procedure that they are doing. So they'll do cardiac catheterizations in this room. They do other interventional radiology procedures in this room. So this is water theme on this unit. And
We're in the canoe right here.
This is our level 4 NICU, and you can bring a preemie here, but really we bring children mostly who have surgical complications, surgical congenital problems, heart disease, abnormalities of their gastrointestinal tract, abnormalities of their lungs.
This is 7.
yeah, so 7 is the skies of Wisconsin. And so that theme was selected in part because these children are complex care children, and so many of them spend a moderate amount of time when they're hospitalized in bed. And so we wanted them to be able to look up and see different things. These folks are able to pick up when they see a seizure that you might not be able to see otherwise. They're able to pick it up, and then they will contact the service immediately to say child's having a seizure. See the light above the bed. And again, now this is intended because children spend a lot of time in their bed when they're here. They're able to
look at that.
They're able to tell us what color they would like their sky to be today. This is the Positive Image Center I'm going to show you next, and this is one of the only children's hospitals that we know of that has this to offer children.
So we have this space where they can get out of their room and come down here and have their hair done or get fitted for a wig if they're experiencing hair loss. And then I have a cart too that I can bring up to the rooms.
And you can do makeup.
And do makeup and nails. Yeah.
Such a good idea. At that Positive Image Center, patients get the full makeover treatment. The cosmetologist does nails, she shampoos, and even colors hair. Like she can spike it up for kids if they want to, and patients can come in often as they want. There are 19 child life specialists who help children and their families cope with the fear and anxiety associated with being in the hospital that you saw earlier. That was the little replica you had of the toy operating room that kind of helps kids calm down and exhale when they go to the hospital.
Very welcoming place.
It's so state of the art, but you would never have, you would never want a reason to have to go inside. So,
but if you have to.
Yeah. So thanks to Barb and Ellen for giving us a glimpse and how lucky we are to have it here.
We are lucky.